Welcome to this educational video on Leber Hereditary Optic Neuropathy, or LHON. LO is a rare, inherited mitochondrial disease that primarily affects the optic nerves, leading to a rapid and severe loss of central vision. In this video, we will explore the causes, symptoms, diagnosis, and management of this debilitating condition. LHON is caused by mutations in mitochondrial DNA, or mTNA. Mitochondria are the powerhouses of our cells, responsible for generating energy. The specific mutations responsible for LO typically affect genes that code for subunits of complex I of the mitochondrial respiratory chain. The three most common mutations occur at position 1778, 404084, and 3460 in the mitochondrial genome. These mutations disrupt the normal function of the respiratory chain, ultimately impacting the energy production within the optic nerve cells. The pathophysiology of LHON is complex, but at its core, the mitochondrial DNA mutations lead to a deficiency in ATP, the primary energy currency of the cell within the retinal ganglion cells. These cells, along with their axons that form the optic nerve, are particularly vulnerable to energy deficits. This energy deficiency triggers oxidative stress, mitochondrial dysfunction, and ultimately, apoptosis, or programmed cell death, of these ganglion cells. The loss of these cells results in the degeneration of the optic nerve and the subsequent loss of central vision. LHON is considered a rare disease with an estimated prevalence of about 1 in 30,000 to 50,000 people. However, the prevalence can vary significantly depending on geographic location and specific populations. Males are affected more frequently than females, with a ratio of approximately 4 to 5 males affected for every female. The disease typically manifests between the ages of 15 and 35, although onset can occur at any age. The hallmark symptom of LHON is a rapid and painless loss of central vision, typically occurring in one eye first, followed by the other eye within weeks or months. Visual acuity often deteriorates to 20/200 or worse. Other symptoms may include blurred vision, difficulty with color vision, particularly red-green discrimination, and the presence of a central scotoma, or blind spot, in the visual field. Some individuals may also experience neurological symptoms, such as tremors, movement disorders, or cardiac abnormalities, although these are less common. The diagnosis of LHON typically involves a thorough ophthalmological examination, including visual acuity testing, visual field testing, and fundus examination to assess the optic nerve. Optical coherence tomography, or OCT, can be used to measure the thickness of the retinal nerve fiber layer, which is often reduced in LHON. Genetic testing is crucial to confirm the diagnosis and identify the specific mitochondrial DNA mutation. This testing can be performed on a blood sample or other tissue sample. While LHON is primarily caused by a few specific mitochondrial DNA mutations, there aren't distinct classifications or types in the traditional sense. However, the specific mutation does influence the likelihood of visual recovery. For example, individuals with the 14484 mutation have a higher chance of spontaneous visual improvement compared to those with the LHON 778 mutation. Currently, there is no cure for LHON. However, there are some treatment options available to help manage the condition. Idebenone, a synthetic analog of coenzyme Q10, is approved in some countries for the treatment of LHON. It acts as an electron carrier, helping to bypass the dysfunctional complex I in the mitochondrial respiratory chain. Other potential treatments under investigation include gene therapy and antioxidant therapies. Supportive care, such as low vision aids and rehabilitation, is also important to help individuals cope with vision loss. Unfortunately, there is no known way to prevent LHON, as it is an inherited genetic condition. Genetic counseling is recommended for families with a history of LHON to assess the risk of passing on the mutation to future generations. Early diagnosis and intervention may help slow the progression of the disease and improve outcomes. The prognosis for LHON is generally poor, with most individuals experiencing permanent and severe vision loss. However, spontaneous visual recovery can occur in some cases, particularly in individuals with the 4484 mutation. Recent research is focused on developing new therapies, including gene therapy, to restore mitochondrial function and prevent vision loss. Clinical trials are ongoing to evaluate the efficacy of these novel treatments.